I'm Matt Willis, Public Health Officer from Marin County with a COVID-19 update for June 28th. I'd like to talk about long COVID, what we're learning about long COVID, some key things we still don't know, and then invite you to help us answer some important questions. By long COVID, I'm talking about symptoms that are the result of COVID-19 infection that persist beyond the acute stage of infection, weeks, months, or even years. Fortunately, the scientific understanding of long COVID is growing every week. I wanted to share 3 important recent findings out of England, where they followed nearly 5 million people through a national health system database, which stood out as relevant for us in Marin. The first is that the risk of long COVID seems linked to the severity of initial infection, meaning that people who are hospitalized are more likely to develop long COVID than people who had mild infections. This is intuitive, but it's helpful to see it verified with the data. Although people with mild initial illness can still have long COVID symptoms, it's less likely and tends to be less severe. The second important finding was that vaccinations do seem to reduce the risk of long COVID. This also makes sense because we know vaccines reduce the risk of serious illness. And third, and this was just published last week, people infected with Omicron were about half as likely to have long COVID symptoms compared to those infected with Delta, the previous most common strain. So taken together, these 3 important risk factors for long COVID, hospitalization with initial infection, lack of vaccination, and infection prior to Omicron, should offer a measure of reassurance for us in Marin. Because our collective efforts have limited hospitalizations, we have among the highest vaccination rates and lowest pre-Omicron case rates anywhere. So put another way, as a community, we may have a relatively favorable risk profile for long COVID. Still, the reality is most of us have been or will be infected, and understanding the potential impact of long COVID is critical for understanding the future impacts of the pandemic in Marin and for our healthcare system. There's a lot we don't know yet. Many viruses that infect humans, including common ones like flu, do cause persistent symptoms after infection for some. This is not unique to COVID. These post-viral syndromes are the result of a variety of different and only partially understood processes. Some are due to inflammation of blood vessels or vasculitis that might explain something like purple toes. Others may be due to neurologic damage and might explain loss of taste or smell, or even brain fog. And others might affect the immune system and cause chronic inflammation. Each may manifest in different symptoms or clusters of symptoms and interact in complex ways and be diagnosed and treated differently. So these questions will not be answered overnight, but getting some basic understanding will be necessary to addressing the emerging public health challenge of long COVID. Another major gap in our understanding is simply the prevalence or collective burden of long COVID within our community. To better understand this, we're asking for your help. Starting later this week, we'll be reaching out to those who have tested positive to voluntarily and anonymously respond to questions about any enduring COVID symptoms they may have. There will be 2 ways to complete the survey we're administering. Some will receive an invitation to complete the long survey via text to the phone number used when informed with a positive result in the past. This will include a link to the survey. In addition, we'll post the survey on our website at the end of this week. So we're not asking you to do anything yet, but your responses to these upcoming invitations will help us serve you better. Throughout this pandemic, we've relied on high-quality local data to guide our response, and we seek to apply this principle to the challenge of long COVID. In this case, because long COVID is complex and experienced in so many different ways by different people, hearing from you and our community directly is the best way to accelerate our understanding, predict impact on our workforce and healthcare system, and plan services for supporting and treating those with enduring COVID-19 illness and long COVID. Thank you for doing your part.